Доступ к
Лишер, как меня
шеринг
слышно?
можно? Нормально. Меня тоже хорошо?
Алло.
Да.
Слышно, да, меня, Лишер?
Слышно. Меня слышно?
Да, все слышно, видно.
К шерингу доступ тоже можно сделать?
Сделал.
Еще вот этот waiting room отключить.
А у меня и так он автоматически отключен, он не без этого
Ну все.
заходит сразу. Hello, everyone. My name is Aslan. I'm representative Scientific and Technology Center Parasat. We're located in Nur Sultan. Welcome to our USMLE webinar. It's our first time to make a webinar in English languages. The main speaker will be Alisher. He will teach you a USMLE courses. He will introduce himself, and Alisher, go on.
Hello, everyone. My name is Alisher. I want to introduce myself for a bit. I graduated from Astana Medical University in 2018. While studying there, I decided to pursue my medical career in the United States. I tried to prepare for the USMLE by myself, but it wasn't as effective as I expected it to be. So I went to KAPLAN Center. After the graduation, I went to KAPLAN Center in Pasadena, California. It took me a year to prepare for step 1. I had my exam there in California. After that, I went back to my country. I spent about 7 months for the preparation for step 2 CK. I took it in Armenia. After that, I was able to take an occupational English test, which is the test of English proficiency. Now I would like to talk about USMLE. USMLE, as you may know, is a 3-step examination program for medical licensure in the United States. There are 3 steps, as I said. The first 2 steps are obligatory to get a residency position. The 3rd step is not. You can take the 3rd step during your first year of residency, or so-called internship year. Before the pandemic, step 2 divided into 2 roads. There was a CK, clinical knowledge, and CS, clinical skills. Clinical skills was canceled, and occupational English test was introduced instead. All right. So the whole path looks like this. So you take USMLE step 1. After that, you take USMLE step 2 clinical knowledge, and then you take occupational English test. After all of that, you are able to participate in the main match process. Okay. So the USMLE interface looks like this. There are 40 questions. There are 7 blocks in step 1. Each block is 60 minutes long. Right. USMLE step 1 assesses your understanding of basic science. So it approximately 8 hours long. It has 280 questions, and it's divided into 7 60-minute blocks, as I said. There are 10 subjects. There are around 10 subjects. The main subjects are pathology, physiology, and pharmacology. These are the most tested subjects. There was a major change this year. On January 2022, USMLE Step 1 score reporting transitioned from a numeric score to pass-fail scoring. In my opinion, that's a big advantage for us, for international medical graduates. Before that, the score report looked like this. So there was a test score, 3 digits test score, and there was a test result, pass or fail. Now it looks like this. There is only one test result. So it's either passed or fail. Step 2, clinical knowledge, assesses your understanding of clinical science. It's approximately 9 hours long. It has 318 multiple choice questions divided into 8 60-minute blocks. There are 5 main subjects in CK: medicine, surgery, pediatrics, OBGYN, and psychiatry. So you can take USMLE steps only at certain places. They are called parametric centers. There are many parametric centers around the world. The closest ones are in Armenia, Turkey, United Arab Emirates, and etc. There is a high level of security. So you can take USMLE only at these centers. Unfortunately, there is no center in Kazakhstan or in Russia or nearby countries. All right, the whole preparation will be using USMLE KAPLAN lecture notes. There is a book for each subject. I think that that's enough to prepare for the USMLE, to take a minimum of passing score. There is a second book called First Aid. Maybe you have heard of something about that. There is First Aid. That's a must-have book for the step 1. Of course, we will give you an access to question banks like AMBOS, UWorld, KAPLAN, etc. Now I would like you to try yourself and take some tests from the USMLE. You can write your answers in the chat. I will give you like 1.5 minutes. Try it. Write your answers in the chat. Do you have any answers, guys?
Come on, guys, do not feel shyness to answer. If you don't understand, we could translate it to Russian language, to Kazakh language, to another languages if you want. Doesn't matter. If you don't understand something, just ask. Put your microphone on or just text a message to the chat and we will answer you guys.
I can give you some clues. That's Kawasaki syndrome. What is the most common complication of this condition?
We have Dana, we have D, we have Hassan, Indira, Engab Khan, Sukhail, Hassan Kamran. Ну, я думаю, то, что Индира, Дана, Ди, кто еще? Этот на русском понимает. Если что, можете, не знаю, написать на русском.
Okay. Okay. You have B, rapid glomerulonephritis. Okay. Right. Right. Let's move on.
Yes.
Oh.
Okay.
I already showed it.
I was just about to say that it is the most common complication of the Kawasaki syndrome, coronary artery aneurysm. Yeah.
Yes, you're right. Who is it?
Sukhail.
Okay, Suhail. Nice to meet you. Yes, you're right. That's a most common complication. As you may know, that Kawasaki syndrome is a necrotizing vasculitis, small arteries. The most fearful and the most common complication is coronary artery aneurysm. Okay, that's right. Next question. All right, that's an anatomy question, anatomy and traumatology. I will give you a clue. That's a common peroneal nerve injury. Common peroneal nerve. All right. The right answer is A, impaired dorsiflexion of the foot. There was an E answer. Okay, no, that's not right. Because it travels along the neck of the fibula. It controlled the dorsiflexion of the foot. Due to its tear, there is a foot drop. There is a symptom of foot drop. So he's not able to dorsiflex his foot. All right. Next question. 32 years old woman, joint pain, erythema, and ulcers. That's an autoimmune condition. That's an autoimmune condition. Which of the following is the right answer? What does she have? Woman with joint pain, with erythema on both cheeks and ulcers. She has SLE, systemic lupus erythematosus. SLE, right? Lupus. What do we have with lupus? We have pancytopenia, right? So the right answer is A, decreased lymphocyte count. There is a decrease in platelet count. There will be decreased complement component 3. There will be increased partial thromboplastin time, not prothrombin time, and there will be increased gamma globulin. All right. If you have any questions, you can write them up in the chat. Any questions related to USMLE, application process, anything. Come on, guys, write something.
Вот подскажите, Индира, вы нас нашли на в Ютубе, и у вас были вопросы. Вот, пожалуйста. В каком формате будет проходить обучение? У нас есть два формата обучения. Первый – это офлайн. Мы расположены в городе Нур-Султан, проспект Республики 24, визит-центр Парасат. Либо мы можем также в онлайн формате. Первый старт групп планируется в офлайн формате 15-18, а онлайн 20 апреля, уже, то есть в этом месяце. Вот. Уроки длятся по 2 раза в неделю, по 2 часа. Итого 8 занятий в месяц. Стоимость обучения за офлайн 50, за онлайн 40. Оплата на ежемесячной основе, Индира. Вот такие вот ответы на вопросы заранее.
Так, ну, комментирую, по-моему. Аслан?
Да.
There is a question from Suhail.
Can you explain about course in more details? What kind of details do you need, Suhail? Окей. То, что я сказал, то, что только на английском, да? Окей. Our lessons will be got two versions. I mean, online and offline. We're located in Nur Sultan. And if you want to go offline, you need to live in Nur Sultan. But doesn't matter if you live in another city, we got an online format. About our courses, it will take 2 hours and twice per week. The total price of offline courses 50,000 about tenge. If you want to online courses, it costs 40,000 tenge per month. If you have another questions about what's this USMLE or stuff like that, Alisher will answer you.
А вы уже сдали все этапы? Step 1, Step 3, Step 2?
Да, как я сказал, я сдал, да. Ну, Step 3
И
только не
сейчас
сдал.
уже
Step
работаете
2
резидент?
сдал. Нет, пока нет еще. Step 3 еще не сдавал, потому что я резидентом еще не работаю.
А на какую специальность планируете?
Посмотрим, куда получится. Ну, вообще планируем, не знаю, наверное, internal medicine. Скорее всего, internal medicine, да. То есть внутренняя, ну, как терапия наша.
А вы, получается, в резидентуру не поступали, да?
Пока нет. Я вот только все
Нет,
закончил.
имеется в виду...
Здесь, Казахстан нет.
Ага, все. Понятно.
Так, total duration of course, it will be 1 year long. So the preparation for step 1 will take 1 year, at least 1 year. It's up to you. It's up to us. Right. Any other questions?
Я вот в Алмате учусь
Ага.
насчет онлайн-обучения. А если других студентов не будет и так далее? Я одна буду учиться или?
Других студентов...
Каслан.
Такого я вам сразу могу сказать, Индира, других студентов.
Будет, да?
То, что это в обязательном порядке будет. Чтобы вы понимали, медицинский университет Астаны, Семея, Караганды, скоро вот будет у нас вебинар для студентов КАЗНМУ имени Асфендиярова, потом Западно-Казахстанского университета. В общем, чтобы вы понимали, очень много университетов вне Астаны получается, и, соответственно, акцент будет делаться на онлайн-обучении, так что, отвечая на ваш вопрос, вы точно не будете одна, уж поверьте.
Ладно, ну на Аслан уже можно завершать, скорее всего, вопрос не будет уже.
Да, в принципе, если что, if you have any questions, guys, please text to this number. It's my number. If you have any questions, if you want to go to USMLE courses, также Индира, данные, если у вас есть какие-то дополнительные вопросы, пожалуйста, вы можете написать вот на этот номер. Это мой номер. Отвечу на любые вопросы. 15 и 20 апреля стартуют уже онлайн-офлайн курсы. Вот. Thank to all of you guys to join our USMLE webinar. Well, that's all. Goodbye.
Thank you. Thank you, guys. Bye.